Most long-term care seniors have now been vaccinated. Thousands more seniors have had their first shots at vaccination clinics. But there is another group of vulnerable seniors still waiting and hoping. They are the ones who can't leave their homes and need mobile health units to come to them. Tonight, the fears they'll be left behind.
I don't want to lose my dad now, and I don't want to lose him to COVID because this is something that's preventable.
Leonora's 90-year-old father lives at home. She says it would be impossible for him to get to a vaccination clinic, and he would never be able to face these lineups.
Not without having an ambulance. We'd have to rent like one of those medical lifts to get him out of bed. And he probably would not even be able to sit in a wheelchair.
Posso salutare? Hello, Leonora. È un'amica mia.
Oh.
Saluta.
Sure.
Leonora fears her father is at high risk of COVID entering his home. 3 different PSWs come to see him every day. 3 additional people come to feed him daily, and family members care for him on weekends.
We have a mini long-term care home here. The reason why he isn't in a long-term care home is because of COVID.
But getting him vaccinated at home has been an exercise in frustration.
I reached out to Toronto Public Health. I was bounced around a couple of times. I finally got an email basically telling me there's no plan. If you can get him to a clinic, here are the links. Personally, I feel like they've been forgotten.
The province insists they have not.
We have not forgotten. It continues to be a conversation on a regular basis.
But there is still a very real fear vulnerable seniors will fall through the cracks. There's a hashtag, No Elder Left Behind. And in Ontario, there are thousands who could be.
You could probably estimate that across Ontario, it's 40,000 individuals that we would see be homebound. People who, for example, getting a vaccine in their own home is a necessity, it's not a convenience.
Some homebound seniors have been getting vaccinated, but it depends on where they live. York Region tells CityNews it began vaccination visits this week. But other GTA public health units like Hamilton, Durham and Peel confirm they're still just in the planning phase.
Almost every person that I call is asking me, either them or their family members, they're asking me, where is our vaccine? This to me makes no sense as to why this high priority and high risk population, was not thought of, in this vaccine rollout, and it was not thought of as really the number one priority after long-term care and other congregate settings.
Getting vaccines to homebound seniors is a logistical challenge. Doses need to be properly stored and thawed. Paramedics need to stay to monitor for side effects, so each visit is time-consuming. Dr. Sinha says pilot projects are beginning in Toronto, and home vaccinations are slowly starting. But he warns,
this is going to take weeks, if not a month or 2 to get this done. We only have so many paramedics.
For Leonora, they just can't come soon enough.
We can prevent this from happening if he gets vaccinated. There is hope, right? And that's what we want, a sense of hope.
Ensuring every homebound senior is reached is a big concern as well. Some don't have the support or computer skills to get them signed up to be vaccinated. Today, the Ontario College of Family Physicians called on the government to get family doctors more involved in vaccination efforts to ensure all patients, including those who are homebound, get a dose.